Magandang buhay mga kaibigan! I'm Lorna Locanias Cartagena. I'm one of the financial educator ng International Marketing Group. In this video, I will discuss the ultimate Kaiser Health Builder na kung saan ito ay best investment. Kung breadwinner ka ng family mo at wala ka pang nasisimula na investment or kaya ikaw ay millennial na nagsisimula pa lang ng iyong career, most recommended ko ito sa iyo dahil ito ay 3-in-1 health savings plan. Meron ka na dito na healthcare, may insurance protection ka na, at may investment ka pa. Kaya sa healthcare plan na ito, secured ang future mo at ng family mo. Maganda din itong pamana sa iyong anak. Start ng 10 years old ay pwede mo nang ikuha ng plan ng iyong anak. Sa murang halaga at sa ilang taon mo lang na pag-iipon o pagbabayad, ay high return of investment pagdating ng panahon. Kaya magpapakita ako ng mga affordable plan para sa 10 years old. To build our solid financial foundation, it's like building a house. We must build our wealth from ground going up. Unahin natin ang healthcare. Next, ang protection. Then eliminate natin ang bad debts. It is very important na meron tayong emergency fund. Para sa mga unexpected events ay may madudukot tayo. And last na ang investment. By following these 5 building blocks, magkakaroon tayo ng financial peace of mind. At kahit anong financial crisis ang dumating sa buhay natin, ay di tayo basta matutumba. Please check the description box below para sa link ng Solid Financial Foundation video. Why it's very important to have healthcare? Without healthcare, with one major illness, you may lose all your investments. Now think of these health realities. Medical expenses doubles every 5 to 7 years. Dahil yan sa inflation rate. Hospitals cannot let you in without deposit and without payment. Majority of Filipinos don't save for healthcare needs. The cost of healthcare products at old age is very expensive. Pagdating sa pagtanda, diyan naglalabasan ng iba't ibang mga sakit at iba't ibang mga maintenance medicine na din ang tinitake. Many parents rely on their children, sell properties or borrow money for medical expenses during retirement. Now, Kaiser International Health Group, Inc. is a health maintenance organization company, duly accredited with the Department of Health, Bureau of Health Facilities and Services. This company is likewise registered with the Securities and Exchange Commission on June 8, 2004 as healthcare provider with an authorized capital stocks of 160 million pesos. In the Philippines, Kaiser International Health Group, Inc. is the sole provider of long-term healthcare na kung saan ito ay needs of every individual, especially after employment and retirement years. Now, ang kagandahan ni Kaiser, ito ay 20 years plan, pero payable lamang siya ng 7 years. So, 3-in-1 health savings plan ito that answer the 3 basic financial needs of every individual. Kaya naman sa Solid Financial Foundation, 3 aspeto na ang sinasagutan ni Kaiser. So, meron ka na dyaang healthcare or HMO, protection or insurance, and investment or savings. So, ganyan kaganda si Ultimate Kaiser. Now, the final test of a good healthcare, does it have both short-term and long-term healthcare? So, si Kaiser, meron siyang short-term na anytime na magkasakit ka ay may magagamit ka for your hospitalization. Meron din itong long-term healthcare na sa iyong pagtanda, wala ka ng trabaho, retired ka na, so meron kang healthcare protection na maaasahan. Does it have guaranteed renewal? So once ma-approve ni Kaiser ang iyong policy, guaranteed na yung mga next year mo ay renewed ang iyong policy. Basta good payer ka lang. Does it have guaranteed savings and investment? Sa Kaiser, all unused health fund accumulates with interest. Kaya kapag hindi ka nagkakasakit, lahat ng ibinayad mo ay nagiging savings at investment mo ito. Does it have life insurance or protection? Sa Kaiser, meron kang 4-way insurance coverage at mamaya pag-uusapan natin yan. So, ito yung basihan ng magandang healthcare. So, sino yung mga government agencies na nagtiwala kay Kaiser International Health Group para maging kanilang healthcare provider? So, nandiyan si Supreme Court of the Philippines, nandiyan ang House of Representatives, at nandiyan din ang Department of Agrarian Reform. Ang mga eligible age para kumuha ng Kaiser ay between 10 years old up to 60 years old. At ang mga minimum plan per age and monthly payment, so for the 10 to 40 years old, ang pinakamababang plan ay K45 na kung saan ang monthly payment ay 2,647. For the age 41 to 50 years old, nandiyan ang plan K60 at ang monthly nito ay 3,529. For the age 51 to 60 years old, so plan K75, ang pinakamababang plan, at ang monthly payment nito ay 4,412. Now, ito yung isang example ng Kaiser Ultimate Health Builder Plan na kung saan ito ay K-Plan 100 at ang contract price nito ay 411,750 at ang annual payment ay 58,821.43. So, yan yung napiling mode of payment ni plan holder. Pag annual kasi ang kinuha mo, nakaka-discount ka ng 2 months. Pero kung hindi mo naman kaya ang annual, so marami ka namang option ng mode of payment. Pwede kang magbayad ng monthly, na kung saan sa K-Plan 100 ay 5,882 ang monthly nito. Sa quarterly, 17,058. At semi-annual na 31,764. Lahat ng plan ay merong 3 periods. So, nandiyan yung accumulation period or ito yung paying period from 1st year up to 7th year. Yung extended period start on the 8th year up to 20th year. So, sa extended period, ito yung waiting period na kung saan ay hindi ka na magbabayad ng iyong plan. No? Waiting ka lang for maturity. And start ng 8th year ay start na rin ng iyong investment ng iyong plan. And then long-term care period. So, start on the 21st year up to 65 years. No? Ito na yung retirement years mo na kung saan ay nag-grow na yung iyong investment. Now, lahat ng mga periods na to ay may mga benefits. So, isa-isahin natin yan. For the accumulation period benefits, so meron kang free medical benefits. Ito yung free annual physical examination to be administered by an accredited clinic. So, syempre sa mga Kaiser accredited clinic ka lang pupunta for the annual physical examination. So, nandiyan yung routine fecalysis, routine urinalysis, complete blood count, and chest x-ray. For ECG and pap smear, ito yung for the members above 35 years old ang pwedeng mag-avail or as required. Okay, second is free dental benefits. So, nandiyan yung unlimited dental checkups, unlimited simple tooth extraction, prophylaxis once a year, recementation of jacket, crowns, inlays, onlays, and minor adjustment of dentures. Okay, third benefit is the basic health benefits. Okay, in case na kailangan magawa ng operating room, hospital, intensive care unit, no? So, syempre doon ka pupunta ulit sa mga accredited Kaiser physicians, specialists, surgeons, and anesthesiologists. Okay, fourth, member's choice of room and board. For the K-Plan 100, so meron kang 1,000 per day for the room and board. Okay, fifth, okay, yearly medical benefit limit of 60,000. Sa term life insurance coverage, so sa K-Plan 100, meron kang 450,000 term life insurance coverage. And meron ka ding accidental death. Okay? If ang cost ng death ay due to accident, then times 2 yan. So magiging 900,000 ang iyong accidental death. And sa dismemberment, so in case of loss of both hands, so 100% ang makukuha sa insurance, loss of both teeth, so 100% din sa insurance, loss of one hand and sight of one eye, 100%, loss of one foot and sight of one eye, 100%, loss of both sight, 100%. No, yan yung dismemberment. Now, eighth benefit, ito yung waiver of installment due to death or credit life. Let's say on the third year, namatay si plan holder, okay, yung remaining 4 years, okay, or remaining years ay waive na ito at hindi na kailangang bayaran pa ng pamilya. Okay? And then fully paid ang plan, makukuha yung insurance benefit, and then matatransfer ang buong plan doon sa beneficiary and waiting na lang doon sa maturity ng plan on the 20th year. Okay, ninth benefit, ito yung waiver of installment due to total and permanent disability. Let's say na aksidente, hindi namatay, pero naging disabled si plan holder. So again, waive ang installment. Okay? Matatransfer kay beneficiary and then waiting na lang for the maturity. Okay. 10th benefit, ito yung family assistance service. Okay, so dito sa family assistance service, meron po itong requirement. So kailangan policy should be an active status and plan should have completed at least 1 year payment. Nominated patient must be an immediate family member of the policyholder or within the first degree of consanguinity. A policyholder agrees to avail only of the services of Kaiser's accredited doctors and affiliated network of hospitals. Assistance to be provided by Kaiser shall only be to the extent of the allowable benefits due to the plan holder under his policy. Let's say 60,000 yung allowable benefits. So, doon lamang po kayo magbabase, no? Doon sa allowed benefits na nakalagay doon sa iyong plan. Prior to discharge of the nominated patient, payment should have been settled to Kaiser. Yan. So, bago po lumabas, no? So, kailangan isettle kay Kaiser muna yung payment. If plan holder requested or opted to pay on a term basis, payment scheme is on case-to-case basis and subject to Kaiser's approval pa rin po yan. Please note that this assistance is an accommodation and not considered a benefit of the plan. Hence, approval and denial on the ailment solely depends on Kaiser management evaluation. So again, itong family assistance service, okay, ay depende pa din po sa approval and denial ng Kaiser management. So, pag natapos mo ng bayaran ang iyong Kaiser, okay, so 7 years natapos mo siyang bayaran, magkakaroon ka po nitong Visa card na kung saan doon papasok ang iyong pera sa Visa card na yan. Now, on the extended period, ito na yung waiting period. On the 8 years, stop na po ang payment. waiting ka na lang ng iyong maturity ng iyong plan. So again, sa extended period, meron kang mga benefits pa rin dito. So nandiyan yung outpatient benefit, okay, inpatient benefit, okay, pre-existing and dreaded illness, pasok na dito dahil during the paying periods, accumulation period, kay hindi po kasama doon ang pre-existing and dreaded illness. Kay pasok na rin dito sa extended period ang maternity benefit, kay dental benefit, and annual health benefit plus the additional health benefit. So, ito po yan. No? So, sa extended healthcare benefits, meron ka ng 10% yearly healthcare benefit limit, no? Dahil on the 8th year, magsisimula ng mag-i-interest, no, yung iyong plan dahil ito ay nasa investment period na, no? So, based doon sa K-Plan 100, on the 8th year, mag-i-interest ito ng 10%. So, 10% interest ng 100,000 ay 10,000. So, yearly magkakaroon ka ng 10,000 interest start ng 8 years up to 20 years, no? And maliban diyan, magkakaroon ka pa ng 10%, no, accumulated unused yearly healthcare benefit. Let's say hindi nagkasakit, no, nanatiling healthy. So magkakaroon ka pa ng another 10% accumulated unused, no, or mga hindi nagamit, no, na dahil hindi ka nagkasakit. Kaya kung makikita mo dito, no, so on the 8th year, nagkaroon ka ng 10,000 interest doon sa iyong K-Plan 100 and nag-accumulate pa ulit ito. So 10% interest doon sa 10,000 ay 1,000. Kung kaya naman sa 10% accumulated unused yearly healthcare benefit mo ay meron ka ng 11,000. Okay? So yung interest, magkakaroon pa ulit siya ng another 10% interest until 20 years. No? Kaya kung titignan natin, on the 8th year up to 20th years, ang total accumulated unused yearly healthcare benefit limit mo ay meron kang 269,750. Now, yung sa K-Plan 100 mo, no, ito yung long-term care benefit value na 100,000. Okay, magkakaroon ka pa ng long-term healthcare bonus na kung saan 85% doon sa contract price na 411,750. Okay, so ibabalik yan sa iyo ang 85% na kung saan 350,000. Yan yung bonus, no, doon sa accumulation period na kung saan hindi ka nagkasakit, wala kang nagamit, so kaya may babalik na bonus sa iyo. Okay? And maliban dyan, magkakaroon ka pa ng additional yearly healthcare benefit limit. So dahil on the second year, nag-start ng mag-interest, no, ang iyong investment. Okay? Kaya meron ka ditong 32,981. Yan yung dividends, no? So yearly magkakaroon ka ng additional yearly healthcare benefit and mag-a-accumulate pa yan yearly. So, ang total additional yearly healthcare benefit mo on the 20th year ay meron kang 446,419. Now, sa total yearly health benefit mo, okay, so kung from 8 years, sa 10% yearly healthcare benefit, meron kang 10,000 and additional 10% accumulated unused yearly healthcare benefit, okay, na 11,000, and then yung dividends mo na additional yearly healthcare benefit mo na 32,981. So in a year, so meron kang total yearly health benefit limit. No? Sa 8 years mo, meron ka ditong 42,981. So yearly, nag-interest yan. So kaya sa total health benefit limit mo ay meron kang 816,168. Now, kung ito total natin lahat, itong total accumulated unused yearly healthcare benefit mo na 269,750 plus the 100,000 long-term care benefit and the 350,000 na long-term care bonus mo, and yung additional yearly healthcare benefit mo na 446,419. So, on the 20th year, ikaw ay merong 1,166,199 good as cash po yan. No? So, on the 20th year, yan yung total health fund mo. Okay? Dahil si plan holder, nag-start siya ng 22 years old nung siya ay kumuha ng plan. Pagdating ng 20 years ng plan niya, ang edad niya ay 42 years old na siya. Now, meron siyang option. It's either kunin niya ang lahat ng yan or half lang ang kunin niya. Dahil pag kinuha niya lahat yan, so mawawala na siya ng healthcare fund. No? Wala na rin siyang Kaiser, dahil withdrawin niya na lahat yon kay Kaiser. Now, para meron pa ring mag-interest kay Kaiser, so it's either half ang kunin niya or yung 10% yearly interest lamang ang kunin niya mula dito sa principal na 1,166,199. So magkano ba ang 10% dyan? No? So meron ding 116,619 no, withdrawable yearly. No? Pwede niyang kunin yon. Okay? Now, sa long-term care period, so ito yung mas maganda. No? Sa long-term care period, no, pagdating ng 60 years old ni plan holder, yung 1 million niya na fund, at the age of 60, no, nag-grow na yung money niya, naging 6,483,800 na ito. Okay? And 10% interest dyan ay withdrawable, worth 648,380. Okay? And pwede niya pang i-extend yan up to age 65 years old, na kung saan ay nag-grow na ito ng naging 10,442,224, no? And an annual lifetime healthcare at the age of 65, so 10% interest ng 10 million ay 1,044,222.40. So yan yung kanyang extended benefit, no? So, nag-grow yung kanyang money. So, money working for you. So, kaya magandang investment si Kaiser. Now, sabi ko nga magandang pamana din si Kaiser sa mga anak, no? Dahil at the age of 10, pwede nang mag-start kuhanan ng plan ang iyong anak. So, itong sample na to, ito ay K45 computation, na kung saan ang monthly nito ay 2,647 at ang contract price nito ay 185,288. Now, at the age of 10, kinuhanan mo ng plan ng iyong anak, na kung saan 20 years plan, no, it gives 524,000 pagdating ng 30 years old nung plan holder. And dahil nga ito ay long-term healthcare, no, it gives 9.1 million at age 60 ni plan holder and gives 14.7 million at age 65 ni plan holder. Kaya magandang investment siya sa murang halaga, no? Nag-grow yung money pagdating ng panahon. Now, so another plan, ito ang K50 plan, na kung saan sa K50 plan na ito, mas maganda siya mas maganda yung benefits. Okay? Konti lang ang difference niya doon sa K45 and yung return of investment ay mas malaki. Now, lahat ng plan ay 3 periods meron din yan, no? At same benefits yan, nagkakaiba lang po sa return of investment. Okay? So, ang contract price nitong K50 ay 205,875. Ang annual payment nito ay 29,411. Okay? So, mas nakakatipid ng 2 months kapag annual payment. Okay? Pero kung hindi kaya ang annual payment, so again, you have option na monthly payment ay 2,941. Ang quarterly payment ay 8,529. Ang semi-annual payment ay 15,882. Okay, sa accumulation period benefits, katulad ng mga una kong nabanggit, ay same din dito ang mga benefits sa 10 years old. So, merong free medical benefits. Okay, nandiyan ang annual physical examination. So, free dental benefits. Okay, basic health benefits. Okay, and members' choice of room and board sa K50. Nandiyan ang 700 per day na room and board. Sa yearly medical benefit limit, kay 50,000 para sa K50. And sa term life insurance coverage, so ito yung kaibahan, no? Sa term life insurance, ang i-cover ni insurance ay ang payor or yung parents na nagbabayad. So sa term life insurance, okay, meron si payor na 225,000 na insurance coverage. Yeah? Yan. So bakit kailangan si payor ang i-cover ni insurance, no? Dahil whatever happened kay payor, no, or doon sa parents na nagbabayad, automatic, fully paid ang plan ng bata. Hindi na kailangang bayaran ng pamilya ang planong bata, kundi automatic fully paid na ito. Dahil ang logic po dyan, si bata ay wala siyang kapasidad na maghanap buhay. No? Kung kaya ang i-cover ng insurance ay si payor. Okay? So, meron din si payor na accidental death and dismemberment. And then, if ang cause of death ay due to accident, so times 2. So, magiging 450,000 ito. And pagdating doon sa dismemberment, katulad ng mga nabanggit ko kanina sa unang plan, so ganun din po ang bawat parte ng katawan ay merong equivalent po yan doon sa insurance. No? Then waiver of installment due to death kapag ka namatay on the 3rd year, no? Yung mga remaining years ay hindi na kailangan pang bayaran. No? Fully paid na yung plan, waived na yung plan, at matatanggap ng beneficiary ang insurance at waiting na lang for the maturity ng plan. Okay? So, waiver of installment due to total and permanent disability. Okay? Pero when the child reaches legal age or 18 years old, no, automatic po yung insurance coverage ay matatransfer na ito sa bata. No? Hindi na doon sa payor or sa parents. So kapag sa legal age na yung bata, so siya na po ang i-cover ng insurance hanggang 20th year ng plan. Now, for the extended healthcare benefit, no? So again, meron din siyang on the 8th year, mag-i-interest na yung plan. No? For the K50, meron na itong, mag-i-interest na ito ng 5,000 yearly hanggang 20th year. No? At magkakaroon pa ito ng 10% accumulated unused yearly healthcare benefit. So, sa computation, so on the 20th year, so magkakaroon ng 134,875 total accumulated unused yearly healthcare. No? And then sa long-term care benefit value na kung saan based doon sa K50 plan, so yung long-term care benefit ay 50,000. No? Plus the long-term healthcare bonus, no, from contract price na 205,875, 85% niyan ay ibabalik at ito yung 175,000. No? And additional yearly healthcare benefit na kung saan ay 223,209, okay, on the 20th year, at yung total yearly healthcare benefit limit no na 408,084. No? So kung on the 20th year, nag-mature ang plan ng 583,084. So yan yung total health fund ngayon on on the 20th year, no? Na kung saan ang bata ay 30 years old na rin siya. Okay? So from the contract price na 205,875, okay? So ang total health fund na ay 583,084 na kung saan ay kung nag-interest no yung money ng 377,209. So money working for you, no? So dahil nga ang Kaiser ay long-term care, so pwedeng hayaan lang yung pera diyan dahil bata pa naman si plan holder, nasa 30 years old pa lang siya, no? Hayaang mag-grow. So ito yung mas maganda, no? So sa long-term care period, nag-grow ng mas malaki yung money na kung saan ang benefits with incentive at age 60 ay umabot na ng 10,174,471. At ang annual lifetime healthcare at age 60 na kung saan 10% no ay withdrawable. Okay? So 10% sa 10 million ay 1,017,447. Okay? Now, iwan lang yung 10 million na yan, mag-grow pa din siya. No, at the age of 65, no, yung benefits no, with incentive at age 65, no, umabot na siya ng 16 million 386,087 at ang annual lifetime healthcare at age 65 ay 1,638,609. So ganyan, kalaki yung grow ng money. Imagine, si parents nagbayad lamang ng 205,875 sa contract price. No? In the long run, ang laki nung naging return of investment. Kaya magandang pamana itong ultimate Kaiser sa anak. Now, your PhilHealth benefit is integrated with Kaiser. No? So once admitted, you will be advised to file your PhilHealth reimbursement form. The PhilHealth reimbursement due shall be deducted from the total hospital bills. Yan. So mandatory po yan. No? Lagi pong kapartner si PhilHealth in any HMO. No? Kaya once na-admit, so i-deduct muna po yung amount kay PhilHealth and then yung remaining bills ay si Kaiser na ang sasagot. If Kaiser members without PhilHealth membership shall shoulder and pay the corresponding portion of the PhilHealth. Kung si Kaiser member, wala siyang PhilHealth, no, siya po ang mag-shoulder nung portion na para kay PhilHealth. Kaya mas maganda po na mag-apply ng PhilHealth. Now, if in case hindi, let's say, hindi nakabayad ng due date si plan holder, no, meron pa namang grace period yan. If payment is made after the grace period, the contract shall be considered lapsed. However, the owner shall be given a grace period of 30 days no, or 1 month to pay. The due installment benefits may be provided to the member only after the due installment is paid. So, ganito po yon. Let's say, ang due date no, ni plan holder no, ay nung July 30 to 2020. Yan yung due date. Okay? At hindi nakabayad ng July 30 si plan holder. Meron pa siyang 30 days grace period para bayaran yung kanyang plan. So ang ika-30th day niya ay magpo-fall yan ng August 28, 2020. So within that period, dapat mabayaran niya yung kanyang due date. No? Dahil kapag hindi niya nabayaran ng August 28, 2020, so considered lapse na yung plan. No? Dahil lumagpas na ito sa grace period. Pero meron pa rin siyang 2 years no para ayusin no yung kanyang reinstatement. So, merong dalawang klase ng reinstatement. So, update and redate. So, ang update, member will pay the premiums due on all the missed months plus surcharge of 1.5% per month or 18% per annum from the date of each unpaid installment. Okay? So kung update, let's say 5 months ang hindi niya nabayaran. So kung i-update niya ito, lahat ng mga missed months, yung 5 months na yon ay babayaran niya plus the surcharge of 1.5 per month. No? So yan. So kung redate naman, so ang sa redate, member will only pay the premium for the month but the maturity period will be moved. No? So for example, simula nung nag-ECQ ng March, no? Hindi na nabayaran ni plan holder yung kanyang monthly dues, no? So gusto niyang i-redate ito. So from March, no, at ngayon March, April, May, June, July, at ngayon siyang August magbabayad at gusto niyang gawin ay redate. So yung redate, yung premium lang niya ng present month. So ang babayaran lang niya ay yung month of August, no? Pero mamumove ang maturity nung kanyang plan. So kung 5 months siyang hindi nakabayad, 5 months ding mamumove ang maturity ng kanyang plan. So ang requirements ng reinstatement, so of course yung reinstatement application form and then yung reinstatement fee of 300 pesos. No? So sabi ko nga, reinstatement can be done within 2 years of the first unpaid due date. The member shall be considered a new applicant subject to pre-existing conditions and for purposes of contestability of insurance coverage and to any other requirements for a new applicant for membership in effect at that time. So again, kung papasok ulit doon sa contestability period na 2 years. Kaiser will cancel the contract without need of notice to the owner if he fails to. All reinstated plans shall be subject to the new price. Ayan. So, if within 2 years, hindi mo na talaga inasikaso, so mag-terminated na po yung plan mo. Yan. So, again, okay, sa pagkuha ng Kaiser Ultimate, no, sa ating solid financial foundation ay nasasagutan na ni Kaiser ang healthcare dahil meron ka ng health card na kahit beyond 60 years old ka ay may magagamit ka. Okay, meron ka na ring protection, no? Meron ka ng 20-year term life insurance coverage kay Kaiser. And meron ka na ding family assistance, kaya in case of emergency needs, ayan, pa-approve mo lang kay Kaiser, no? Yung iyong plan, and then may magagamit na si family. And meron ka na ring investment, no? Dahil si Kaiser, meron siyang 10% interest yearly. So, importante po na we have to build it right, yung ating solid financial foundation, and build it strong. Don't forget to click the like button and please subscribe to my channel. And wag mo rin pong kalimutan na i-click ang notification bell para ma-notify ka sa mga next videos ko. Yan, so again, I'm Lorna Locanias Cartagena na mag-message lamang po kayo sa akin kung kayo ay may mga tanong. Okay? So muli po, okay, hangad ko ang magandang buhay para sa ating lahat.